I teach public health nursing, and we have both a classroom component and a clinical component. And I teach the classroom part, and I teach one of the clinical parts. There are 5 different clinical components because the class is divided up and they work in different areas. And in the classroom part, we cover epidemiology, communicable disease, vulnerable populations, social determinants of health, implicit bias, emergency preparedness, and then they also work out in the community for a full day each week. My goals for the students are always to learn, the public health principles, but also to become a part of the community and to feel a part of the community, because then they start to understand why people do things in the community that they do, why they make certain decisions. When we first had to go online, I was looking at all the different technologies. I had never taught a course online. So I was looking at all the different technologies, and I like technology, so it didn't scare me, but there was so much to learn. So I started realizing that I was spending too much time on just the technology. And so I said, stop, I can't do that anymore. I found a few technologies that work. I need to spend more time on the content. I need to spend more time on the learning objectives. I need to spend more time on making sure that my students learn to think like a nurse and to do all the things that we consider important, and figure out what was best for my students to be able to really feel what was happening with their families, and really understand all of the things that were going on with COVID-19 and how to apply that, how that manifests itself, and how as a nurse we could help them to prevent the further spread of COVID-19. While I was thinking about how we could modify some of our assignments, they always do reflections. And so I asked them to do a reflection about being the only public health nursing students at the university at this time in history, and how that affected how they reacted to the pandemic. And so many of them talked about how other people came to them with questions because they had been talking about it, and they knew the epidemiology, and they knew some of the facts about the virus. So that was a very positive thing. They felt very good about that. It was the best time to be teaching public health nursing, because so often public health has been taken for granted, and people don't it's not considered as important as other types of nursing. It may not, or not as glamorous. Well, this allowed people to see how public health is a very important part of our health system. And a lot of them talked about how maybe in the future, public health or community health, working in communities and working with communities, was starting to be more attractive to them. Nursing as a whole gained a lot of respect during the pandemic. What it means to me to be a community engaged teacher in the time of trauma or in the time of anything, my philosophy of nursing or of community nursing is to respond to both the needs of the community and the student. If I respond to what the needs of the community are, then the learning needs of my students will follow. They will learn from that, and they'll learn the most important lessons that of caring for other people, and I'll make sure that they get all the principles of public health and that kind of thing. But if they respond to the needs of the community, then it's like a self-teaching lesson, because when you do that, you see how you make a difference, and you see how important that is to the community, and that makes the students feel good, that makes them feel needed, that makes them, and then they're more engaged, and then the more engaged you can get them, the more they learn, the more that they feel that what they're doing is important.